blogtalkradio.nyc.
We're back. It's another week. It's Philanthropy and Focus time in the attic. So I'm 2 flights up from the kitchen, just below the roof of my house, where I have been for many, many, many weeks and months and years, up in the attic. The show was originated up in the attic, although I did talk about it for a bunch of years before I actually did it. It took the historic time, in our lifetimes, the pandemic time, for me to actually launch the show back in January of 2021, which is just unbelievable how time flies when you're having fun, as they say. So my guest today is Claudia Boyle. Good morning, Claudia. Before I jump into all the things I want to say, good morning. What's going on? How are you?
Good morning. I'm doing great. Thank you. I'm excited to be here.
I'm excited to have you here. And as the nonprofit sector connector, I say all the time, if it wasn't for the people in my network making relationships for me, if it wasn't for people in my network making introductions for me, then I don't know as many people, right? So as maybe I'm some great connector, people might say, but I hang out with a lot of people who are looking out for me as well. So you and I actually met from our friend Hassan Maksud when we were at a golf outing for an organization. Was it a federation of organizations?
Correct.
Yeah,
Yes, he was being honored.
he gets honored a lot. Hassam is a good man. He does a lot in the nonprofit sector. Was he an honoree at your gala, or is he on your board?
Both. He was an honoree at our gala 2 years ago, and now he's on our board of directors.
That's awesome. So what do we talk about? We're talking about the Hispanic Counseling Center out here on Long Island, my hometown. I've never left Long Island for more than like 7 days in a row. Stayed home for college, went to school in the city for a little while, Nassau College, and then the city for a little while, and then SUNY Old Westbury out here on the island. And it's funny how life is, because I went to school at SUNY Old Westbury, and I'm also on the board of directors for Horseability, which is on the campus of SUNY Old Westbury. So home game for us today. Excited to have you here, Claudia. I mean, you talk about home game. I mean, you've traveled around the planet a bit. We're going to learn some of that in your story today, but I'm on this whole trip, as I've talked to you about, and I think many others, hashtag ending the stigma together. We must, I say must, end the stigma around the conversation around mental illness, mental health challenges, however you want to phrase it. We need to have these dialogues, and I continue to push and be on the front lines of having these open dialogues. And an organization like yours, as we mentioned right before the show started, is doing this important work, is doing the important work in communities that need the important work done. And I want to ask you, like I've asked so many other folks who've come on this show, tell us about your journey. I mean, as the chief executive officer of the Hispanic Counseling Center here on Long Island, where did it start? Did you say one day I want to be in the States on Long Island running this organization? I'm sure it didn't start exactly like that. So tell us the story, please.
So the story started in Colombia, in Barranquilla, Colombia, where I was born. I knew from a very early age that I wanted to be a helper. I just wanted to help people. That was just in my nature. I started very young thinking, what can I do to help others? It kind of got delayed a little bit because I was also really good at math. So I thought, maybe I could be an engineer. I'm the last one, very spoiled last one of 5.
Wow.
So I have 4 big brothers who are my world, and I am theirs. So it was, I think that that's where I learned it. My mom was also a helper. So anyway, long story short, I started engineering, thinking that I would follow in the steps of my brothers, that they're all engineers.
All four.
Well, the last one, the first one that passed away when I was young, but the other 3 are all engineers and they all work in their field. So I said, you know what, maybe I should do the same. I should follow in the steps of my brothers. But then after a year and a half, I started taking linear design and I was like, yeah, this is not me. So I switched to psychology. And I started studying psychology at Universidad del Norte. Shout out to my hometown, Barranquilla.
Kia.
And
I was practicing that. I got to interrupt you because I was practicing it and I was Barranquilla. Is that good?
it is good. I mean, it would be better if you go "Rrr, Barranquilla because
Barranquilla. Like that? Is that too much?
yeah, but you did a good job for your first try. I can tell you
Thank you.
that.
Thank
So,
you.
Barranquilla, Colombia, and over there, it's 5 years undergrad, not four. So in my fifth year, I was supposed to do my internship, and I told my dean, you know what, I don't really see anything here where I could learn, like in a hospital or in a outpatient setting. We don't have that kinds of things in Colombia. So I asked her, is there anything I can do different? And she said, well, we have a partnership with the University of Miami, Jackson Memorial Hospital, for you to be able to do an internship with Dr. Sapochnik, which is the family therapy. It was family therapy for Latino families. So, but she said you have to make your own way. You know, we can't give you any funding or anything like that. So I spoke to my parents and they said, you know what, go for it. We'll figure it out.
So
Uh,
it was an unpaid internship, is that right? So you had to find housing, you had to find a way to feed yourself while you were doing the internship, right? So that's not easy stuff.
Yes, it's not easy, but you know, I've always been very fortunate, Tommy. I've had my family and they've always had my back no matter what. They would figure it out. So I moved here. We had an apartment in Florida. My mom had purchased it a long time ago. So I moved there. It was about an hour from UM, but I drove every day. I went there to work and I worked with Dr. Sapochnik for about a year doing research and working with Latina girls. That's where my passion started. That's when I realized that even though I wanted to help, helping my community in a different country was like a dream come true. So I started working with them and they recommended that I should do my master's degree and that they would send a letter to to recommend me for the program, the master's program. So I did. I got in, I got accepted, and I graduated with my master's in 1997. So
So what was
that
that? What was your master in social work or
No, my master's was in science and mental health counseling. So I was a mental health counselor and I got my license as a mental health counselor as well.
got it.
I went back home for a little while because my mom got sick. So I wanted, I've always put family first. So I went back home, took care of my mom for a while, and then I came back in 2001 and started working at PACE Center for Girls. Is an alternative school for underserved girls, whether it be Latino, it can be white, it can be, the African American population. They just have to be underserved and they were involved in some way in the juvenile justice system, whether it be because they were at risk or maybe they were already in the juvenile justice system, but I worked at an alternative school. So they would come there every day for schooling and also for counseling. And I had like 20 girls in my caseload, and it was life-changing doing that work,
That was still in, I just Googled it. That was in Florida. That was in Jacksonville. Is that right?
No, no, the Jacksonville is one of the centers. There's 19 centers in Florida.
Okay.
One of them is in Broward County.
Okay.
It was called Wilton Manors, and it's still there. I mean, it's still functioning and they do amazing work. So I was there until 2007 when I moved to New York with my husband. My husband works for New York Life Insurance Company, and he got promoted, so we moved to New York in 2007. And you get here, you don't know anyone. You're like, what am I going to do now? So my husband put me in contact with some of his friends that knew of counseling centers in New York, in Long Island.
Yeah.
And the first one on the list was the Hispanic Counseling Center.
So first of all, that's awesome. It's the first one on the list, but I mean, I have to say it probably was the best fit. I don't know where else was on the list, but it just makes the most sense from your background, your interest, especially, serving the community, as you say, here in the States. Was it like a no-brainer for you when?
Well, at the time, I didn't know that. It is a no-brainer.
Right.
But at the time, I didn't know that because I didn't really know anything about the Hispanic Counseling Center until I did my research and I came here for the interview. But as soon as I walked in and I did my interview with Irene, which was the associate director at the time, I knew that this was where I needed to be.
Yeah.
So I interviewed on, yeah, I think it was the beginning of May, and I got hired on May 14th, 2007.
How
And I've
long,
been here
how
since
long had you been up in New York at that point? Was it a long time?
3 months.
3 months. So pretty
Yeah.
quick. And it sounds like you said your husband started introducing you to friends of his up here. Was he from Florida? Was he from New York or
No, my husband is originally from New Jersey. He was born in Whippany, New Jersey, and he was very familiar with the New York area because he grew around here. So
we started
it
making,
was more his territory than mine.
yeah, it was more his territory, but he also then started networking for you, right? Said, look, maybe talk to this person, talk to that person, that whole thing. Yeah, so that's we're going to get into the programs of what the organization does and how it makes an impact. So we'll see how much of a no-brainer, obviously it turned out to be. But you're with the organization for 17 years now, right? Going into 18 years. So, and we're going to talk about, your journey through the organization and what happened and the impact that the organization's making. We're going to have a lot of fun conversations about this stuff. I got one quick question before we go to a break in a second here. Did you, when you were growing up in Barranquilla, Colombia, did
Good
you,
job.
how'd I do? Good. Did you ever think like, see, look, I'm from Long Island. I've never really left Long Island. Like, this is my hometown. Like, you go on vacation for a week, that's it. I don't know that I would have ever moved to Long Island, but this is where I'm from, so this is where I am, right? Did you ever have the desire growing up in Colombia to say, I want to be in the States one day? Like, is that important? Was it important to you to be here, or it's kind of happened with some of the opportunities?
I think it just kind of happened. I was very happy where I was. Barranquilla is a wonderful place to be. But I wanted more. I didn't know that it was going to be in the United States, but I wanted more. I wanted to practice my profession. I wanted to do clinical work.
Yeah.
And this was the opportunity that God presented to me, so I took it.
Yeah. Listen, well, isn't that a great thing for people to listen to? An opportunity is in front of us and we take advantage of it. That's really the stuff we have to consider and think about. It's critically important. What do you think if you look back, I never have asked anybody this question, but for some reason it's coming up for me, so I'm going to ask it. If you looked at little Claudia back in Barranquilla and asked her, what she thinks of the trip, what she thinks of this journey that you've been on, what do you think she would say?
I think she would say, man, I don't think I could move anywhere else and be away from my family. I think that's what she would say.
Yeah.
Because to this day, it's still very difficult to be so far away from all of them.
Yeah.
Very close.
Your brothers are still there. Or both your parents are gone now?
Yeah, both my parents are gone. But one brother is in Florida, the other two are in Colombia.
In Colombia.
So I go back and forth a lot and we see each other often.
How long does it take to fly to Colombia from New York?
If it's straight from New York, it's 5 hours.
Okay.
And from Florida is about 2.5.
About 2.5 hours. Okay. All right. So this is good stuff. So I've never been to Colombia. I've heard it's a
You
beautiful.
should go.
I should go. I have heard. We got a lot we're going to go into. We're going to take a quick break now. We're going to take a break a little early because I want to use the time as we go into our next segment. So we're going to break now. We come right back. We're going to talk about the Hispanic Counseling Center. We're going to talk about your journey at the Hispanic Counseling Center, really where you started out doing the work, doing the clinical work, providing, excuse me, not education, but the services to individuals, to families and group counseling, and then how that eventually turned into the point where now you're leader of the organization as CEO. How's that sound?
That sounds great.
All right, we'll take
Thank
a quick
you.
break right now. Philanthropy in Focus.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
If you don't have your health, what do you really have? It's time to feel good in your body and shift from struggle to ease. Hi, I'm Elizabeth Tripp, your host of Nourish the Soul, where we explore the sacred wisdom of your body while you sit back, relax, and go on a journey of self-discovery. Join me every Tuesday at 6 p.m. Eastern Standard Time to awaken your heart, transform your well-being, and unlock a deeper understanding of yourself.
You're listening to Talk Radio NYC. Uplift, educate, empower.
Nonprofits need connections to move in good directions. So cut through all the static. Join Tommy in his attic.
We are back. Go check out the website, everybody, HispanicCounseling.org. HispanicCounseling.org. Throughout the show, I'll share the website so you all could check it out. My guest is the CEO of Hispanic Counseling Center, Claudia Boyle. Claudia, we started with your story. We started with the work you've done. We started with Miami. We started with you go to your master's. You get your master's in science and mental health counseling. You said you wanted to be a helper, right? That was what was important to you from the beginning, to be a helper. What have you become that helper in the work you do, and what you're doing right now? Do you feel like you're a helper?
I do. I mean, I certainly have to admit that I felt more of a helper when I was doing the work directly as a therapist, because you really feel it. You see it every day. You work with people, you try to meet them where they're at, and then you try to kind of normalize their situation so that they know that it's okay for them to feel that it's not okay. And then you help them through it. I do have to say my favorite population was the adolescents. I really enjoyed working with them, helping them through their confusion, their struggles, their anger, their frustration. It was really, really wonderful for me. But yeah, I do feel like I still help, because I help my employees, and by helping them, I help the clients, right? It's like, if I take care of my employees, I take care of the agency, I take care of feeling the way that we feel as a family, then they feel good in what they're doing. And then in turn, they take care of our clients, which is ultimately our goal.
Yeah, so I want to address that piece right there, because I have a lot of friends who run and lead organizations, excuse me, not necessarily similar to yours, but serving similar populations to yours. I was out with my friend Yolanda Rabano Gross from Options for Community Living earlier this week. We were meeting. And a lot of questions I ask these friends is, how do you make sure that you're taking care of your staff? Because, I believe that we all have mental health issues that we're working through. And when the population that an organization is serving are people with mental health issues or more severe mental health issues, that could be draining and tough on staff. So how often do you as an organization check in on staff?
Well, I mean, first of all, to your point, there's no way that you work with populations like ours and not have some kind of vicarious trauma. That's what it's called when you're, burnt out. And so it's very important for people to have self-care. So I put that first. I think that that's the overall answer that I can give you, because I think that we put the staff first, and we check in when we need to check in. There are weekly meetings that each coordinator has with their staff, and then I have meetings with the coordinators as well. So that's kind of the way that we check in. But we put the employee first in many aspects. Whatever it is that they need, we meet them where they're at. That we have a comprehensive PTO package that we can give them so that they can use that time for emergencies, for family time, for mental health day. We have an outing every year I wish we could do more than one, but we have one outing every year where we do like a team thing. We go to the beach and we just hang out and talk and spend our day. So I think that having an open door policy in our agency is extremely important for both the coordinators and the associate director and myself. We have an open door policy. So we don't know everything, but we definitely offer that support. And additional to that, Tommy, I think that your comment about that our employees are people as well, and that they also have mental health issues that they have to deal with, during the pandemic, that was extremely evident. Because, we were thinking, okay, we have to have a pantry for the clients. We have to have, videos for the clients. But then I realized, what about the employees? I mean, the employees are people too. They are going through struggles. Just because they work at a mental health clinic or at a serving organization doesn't preclude them for having mental health issues, right? Or for feeling a certain way. So it definitely touched home. And I realized that we need to focus on, if I focus on my staff and I make their priorities important, they're going to do the same with the client. So it's kind of a pay it forward kind of situation, right? And in turn, they take care of me too. I mean, they're wonderful. They're there if I need them. They support me if I need, if I need whatever.
Yeah.
They're always, yes, boss, whatever you need, we're there for you. So
it's interesting. I don't usually talk much about our business here on the program. This benefits agency that we own called Vanguard Benefits, and we sell and service employee benefits for businesses, but with a major focus on the nonprofit sector. And the reason I bring it up is because I convinced myself a long time ago that the more we as an agency are able to work with inside the nonprofit sector, that if we're able to help these individual people from a benefits perspective, so they're not worried about insurance, they're not worried about claims, they're not worried about explanation of benefits for their insurance needs, well, then I believe that's one less stressor that this employee who's either a mom or a dad or a daughter or son, and who can then focus more clearly on the work at hand. So it's interesting. It feels like, you mentioned PTO, you mentioned going out into the beach and doing things like that. To me, that goes to culture. We talk a lot about the HR space and as it relates to benefits as a culture. What is the culture of the organization? So I think just kudos to you and your team for having that open door policy. It's critically important. And I don't know if now so more than ever. I think now so more than ever, we realize how important these things are. I think these needs were always there, and some companies do, and some companies didn't. And now, putting it out on the front lines is just important to keep having the discussion, and people realize. It's something else came up for me while you're talking. Some of our friends who run other organizations, many of their employees don't earn enough wages in this nonprofit sector. And you and I said a cute thing before we got the show started. You said, I just want to make sure I don't say anything I'm going to regret. So I'm just going to say something that I'm not going to regret it, but it might be controversial. Hey gang, the nonprofit sector connector is not paid appropriately. There are people that make minimum wage that are taking care of your senior parents, your children or adult children with intellectual and developmental disabilities, and they're making minimum wage. And at times they need to go get a second and or third job to make ends meet. That's wrong. It's inappropriate. It doesn't work. Something needs to be resolved there. I don't have the answer, but I will stand up on the soapbox and complain about it and say we need to talk about it because it's not right. So when you mentioned the pantry, so that's just kind of a funny thing. Sometimes direct care workers, right? They're direct service professionals, right? They are considered professionals. And I was having this conversation with a friend of mine just the other night, and he runs a major Long Island nonprofit organization. So these individuals sometimes actually needed to go to the pantry. They're serving the folks at the pantry right, and they need to utilize the services. We got to remember this, gang. We got to be compassionate. I don't know if you have a comment on that, Claudia.
No, I agree with you 100%. I really think that our professions in general, social workers, mental health counselors, the people that do the work, community health workers, you have, SUD counselors, CASACs, all those different types of people that help others all the time, I don't think they are paid enough.
Yeah.
There's not enough resources to do that. And as a non-for-profit, it's very difficult to do that. We try because, non-for-profit leaders get together and talk about that. How can we improve this? But it's just very difficult because there's a lot of need out there, a lot of need. I mean, Tommy, for the mental health clinic and the substance use clinic, we get 25 calls a day, 20 calls a day. So this is about 125 people calling in a week. Multiply that by 52.
Yeah.
That's a lot. It's a big burden.
It's a big,
During the pandemic, one of the things that really stroked me the most was that, essential workers, yes, definitely the nurses and the doctors that were doing the work on in the field, they were definitely essential. But also mental health workers, also people that work with, dealing with your substance use, talking to someone and making sure that that person is able to at least express themselves. We're essential workers too.
yeah.
So we have to keep that in mind.
Yeah. Yeah. The pandemic certainly was challenging in a lot of ways, and I think it also uncovered a lot of opportunities, and sometimes it feels uncomfortable to say that, but it uncovered a lot of opportunities, and it made people more aware of certain things. And that's some of the benefits of that time period in history where we're more aware and more focused on being part of the solution and creating things that people need. I'm sure you saw much of it in your own organization, like you said.
I agree 100% because, I believe firmly that after every storm, something gets uncovered. You know
Yeah.
what I mean? Like all this craziness that happens, things get turned around, and then you realize that you can learn from that experience and, kind of like a half full glass
Yeah.
situation. So yes, pandemic was horrifying. A lot of people lost loved ones. There's a lot of things going on, but the reality is that it brought to the surface, which is the way that I want to explain it.
Yeah.
Because it's always been there in the deep end, but now it's brought up to the surface that mental health is essential.
Yeah.
Now, I'm not talking about mental illness, because that's different. I'm talking about mental health. Taking care of your mental health is essential. And when you ignore it, and you don't want to talk about it, and you don't want to realize that it's there, you are doing a disservice to yourself. So the pandemic also accelerated telehealth.
Yeah.
Before the pandemic, we were trying to get telehealth to be kind of like a way of serving the community as well. And it was always very difficult. It was a long process, 500 million applications. But after the pandemic, they said this is an emergency state. Let's make it available to everyone. And now, even though I don't feel that it should be the only way, I don't believe that you should only have telehealth as a service. The in-person part is extremely important for mental health and substance use clients. But telehealth can be a tool.
Yeah.
It can be something that can help you, right? I can't come to you. I have a transportation. We could spend hours talking about the social determinants of health and how that interferes too. But, if a client calls me and says, I can't come, I don't have a way to get to your office. Okay, let's switch it. Let's do a telehealth session and just check in with you.
Yeah.
Right? So definitely the pandemic showed us how important ending the stigma of mental health is.
And that's what I say, silver lining in the cloud of the pandemic. And telehealth is a great service, not just for mental health, but for other health needs too. I mean, not everything needs to, you don't need to go and travel somewhere. So when we come back, I want to just one thing you said, and then we're going to take a break. When we come back, I want to go through what the organization is all about. Like we talked about a little bit about your journey in the organization, and what a day in the life of the organization looks like. But you said it's okay for you to say you're not okay. Did I get that right?
Yes, you did.
Yeah. It's okay for you to say you're not okay, gang. That's okay. And self-care is not selfish. Like these are things we must know. There's that old cliche about the oxygen mask, and when the oxygen mask you put your oxygen mask on first if you're an adult, so you can take care of other people. It's become cliche, but it's a real thing. You have to take care of yourself. And I'm speaking to you all, but I'm speaking to me right now too, because you must take care of your own physical health and mental health, that you can't be a service for anybody else. So we'll take a quick break. We come back. I want to talk about programs. I want to talk about what the organization is doing on a daily basis. So we're going to take a quick 30-second break. Right back. Philanthropy and Focus. Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host the program Philanthropy and Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Were you an essential worker during the pandemic? If you needed to learn stages of epilepsy, did you depend on advocates? Did you use new innovations to cope with mental and neurological issues? Maintaining high quality of life and keeping good mental health are what we all strive for. I'm Frank R. Harrison, host of Frank About Health, and each week top healthcare influencers, professionals, and innovators answer these questions and more. Stay tuned on Thursdays at 5 p.m. on talkradio.nyc, and I will continue to be frank about health with all of you.
Hi, I'm Linda Marcanico. The A Train to Sedona is a memoir about my journey to love and compassion. It's also the name of my new broadcast on Wednesdays at 12 noon. When we are spiritual, we embrace possibilities and ideas, which strengthen our mind, body, spirit, health, and wisdom. On the A Train to Sedona broadcast, I plan to interview guests who embrace these expansive practices. Join us on Wednesdays at 12 noon on Talk Radio New York City.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Nonprofits need connections to move in good directions. So cut through all the static. Join Tommy in his attic.
That's right. Cut through the static, baby. Let's go. All right. So I was sharing the website again, HispanicCounseling.org, HispanicCounseling.org for everybody, if you're listening only. You know, I shared a lot of the programs. I mean, this is a robust organization, you know, serving many, many needs of individuals. So why don't we talk about when, you know, I guess, like I said earlier, like a day in the life of the organization, you said we get 25 new phone calls every day. Let's talk a little bit about what this feels like, you know, from an organizational perspective. Like the calls come in, what goes on here?
So, I mean, before I go into that, I just wanted to clarify for you, like, I feel that the Hispanic Counseling Center, I don't feel, I know that the Hispanic Counseling Center is a one-stop shop for people. So the first thing I wanted to tell you is we are the only licensed bilingual bicultural agency in Long Island. We have offices in Hempstead and in Bayshore. So a day in the life off, you're gonna have, okay, my light went off, so let me turn it back on. So we have, like I said, phone calls coming in all day long of people that need help. So that might look different for different people. It can be they just need, you know, direct services. They need pantry. They need, we have a program called Community Mental Health Promotion and Support, which its only goal is to end the stigma of mental health and educate the community about it. So we get a lot of calls for people like with specific needs. They don't even know what they want or what they need. They just know that they need help. So the phone calls are routed to people who take the screening, take their information, ask a few questions about, you know, what do you need? What is it that we can do for you? And then they direct that to whatever program it fits those needs. So it can be mental health, it can be substance use, it can be prevention services, it can be education and outreach. You know, we have the domestic violence program that provides education for batterers of domestic violence. So we serve the clients in the clinic and we serve the batterers in this specific program.
Well, so let's stop fit. Let's pause right there. So I was sharing a flyer from the website, everybody, you know, the Community Mental Health Promotion and Support. If you're in Nassau County and you need help, 516-317-6737. If you're in Suffolk County, 516-318-1081. If you're in Nassau, 516-317-6737. And if you're in Suffolk, 516-318-1081. Something I heard that I haven't really heard before from other agencies is education for the perpetrator of DV, of domestic violence. So I mean, I'm just going to pretend like I don't know anything. Why would we be even focused on that? Why is that important? Tell me about that.
So, first of all, I want to tell you that this is something that the DA's office is helping us with. It was a initiative we started a few years ago, and the purpose of it was, if we treat the victim only, we're only treating the symptom, right? Of course, we're going to help the victim, and we're going to help them through it, and we're going to figure out how to help them feel better. But we're dealing with the source, right? Domestic violence is not a one-dimensional situation. Being a domestic violence perpetrator doesn't immediately make you a bad person. So what we're doing is treating the disease at the source, if you were to compare it with physical illness, right? So the domestic violence intervention, it's called Domestic Violence Batterers Intervention Program, and it's based on the Duluth model. The Duluth model is an evidence-based model for perpetrators of domestic violence. And what it does is it helps the perpetrator realize, what is it that I'm doing that is contributing to this situation, and what can I do to stop it? What can I do for this not to become my go-to when I'm frustrated, when I'm angry, when I'm under the influence? Like, what can I do, right? So if you compare it to a physical ailment, it's like finding the source of an illness and then treating it.
Let's think about this, folks. Without figuring out that this is a behavioral issue, right? And without educating the people with other options on behaviors, and maybe listen, what are they, that thing, hurt people, right? There was probably, I mean, you're the clinician, not me, but there was probably some level of abuse in the abuser's past, right? Where they realize that this is, again, I'm making a blanket statement about millions of individuals, but behaviors come from experience. Behaviors come from reactions and things like that, right? So folks might think, you fly off the handle, you get upset, and tragically somebody gets hit or hurt even worse than that. The perpetrator or the batterer, as you say, doesn't know other behaviors maybe, or doesn't realize that they could have other choices, right? So we have to go and get this stuff out the source.
So there is that component, yes. So yes, trauma, I would say more than experience, the way you express it, I would call it trauma. Trauma is the source for a lot of deviant behavior, a lot of non-traditional, situations. So trauma is usually always at the head of it, right? Now, I can't say, like you said, a blanket statement that every batterer necessarily had a traumatic experience or was a victim of domestic violence themselves. But most of the time, that is the case. You know what I mean? So yes, trauma is at the head of the situation. So when you deal with that, and when you bring that to the forefront, that also helps the batterer understand that maybe, I can deal with it different. And then we go to the second part of it, which is coping skills.
Yeah.
So batterers have two things. It's internal. It might be an internal thing because it comes from trauma, but it's also environmental, right? Something is going on in their environment. Something is going on with their parents. Something is going on with their family. Some trauma affected the situation. So it's both. So what you're doing with the Batterers Intervention Program is kind of trying to bring that to the forefront and realize, what can I do with this that I can't change? Let's go back a little bit. So if you can't change the situation, the only option is to change yourself. That's kind of the premise of the Domestic Violence Batterers Intervention Program. You can't change what happened, whether it be trauma, whether it be the way that I deal with trauma, whether it be the coping skills that I have. So what do I have to do? Change myself.
Mm-hmm.
So before I can change myself, I have to realize what's going on, what is it that I need to change, and then help changing it. So that's kind of at the core of the Domestic Violence Batterers Intervention Program.
So if somebody comes in, who was in a domestic violence situation, and he or she comes to the center, is the center doing outreach to the batterer as well, or sometimes it's the batterer that comes in and realizes, I need help?
So both situations. They can be mandated for treatment because of a situation. They can be in a domestic violence situation and realize that they need the help, or they can be outreach to. But then the outreach is not, hey, Tommy, are you a batterer? Can you come to my program, right? The education and the outreach is about domestic violence as a situation. So one of the responsibilities of the coordinator of that program is to go to events, go to the community and talk about what is domestic violence, what does it mean, what can you do about it, right? And that brings about, the victim saying, I think this person should go to that program, or the DA's office referring someone for treatment, the court referring someone for treatment, CPS referring someone for treatment, or someone realizing that they need that. Because along with the domestic violence batterers intervention program, Tommy, we have the nurturing parenting, which is also an evidence-based program that is, there's modules, and one of the modules is for batterers and their families. So how do I parent my kids through what they've been going through, right? How do I become a better parent despite the situation that I can't change? So that also comes with it. So as a parent, sometimes they think, you know what, I need help. I'm a victim of domestic violence, but I don't know how to work with my kids with this. How do I explain what's going on? How do I parent them moving forward? So they work in tandem together, the domestic violence program and the nurturing parenting program. And the beauty of it is that it's completely bilingual. So if you're a native Spanish speaker and you don't speak the language, you can also benefit from the individual, the family sessions, and the educational session.
Yeah. So, we could do one show just based on this level of service that you provide.
Yes.
There's obviously a lot there, but I want to make sure you hit upon some other, children and family services, outpatient clinic, HIV
Right.
AIDS consultation, things like that. So talk to me about some of that.
Okay, so think about the services of the Hispanic Counseling Center as three spheres. We have direct treatment, we have prevention, and then we have the children's programs, right? So when it comes to treatment, we have individual mental health clinic, group mental health, substance use, both individual, group, family, and the educational series. But then we also have the Ryan White program that does kind of similar in terms of mental health, because we have a licensed clinician that provides the services, but it's for people who have been diagnosed with HIV and AIDS and have no other means. Like they don't have insurance, they're underserved. So we provide individual, a little light case management, and we help them through that. And then additional to that, we have the care coordination program, right? The care coordination program is for people who have 2 or 3 diagnoses and they're overwhelmed. It's difficult to live with mental health, with mental illness, very difficult. So the care coordination programs provide support for those individuals and helps them with benefits, entitlements, appointments, anything that they need to help them get through what they're going through. Additional to that, we have the supportive housing program, also for people who've been diagnosed with severe mental illness and cannot find housing. So they're referred to us and we help them with that. In terms of the family and children's programs, we have prevention programs for SUD. We have prevention programs for mental health. We go into the shelters and we help people with psychological first aid, skills for psychological recovery. And then we have an indoor, like in our office in Nassau, we have an after school program. We are open Monday through Thursday from 2 to 7 p.m. The kids come, they hang out, they do their homework, they have a place to do exercise, they have a place to read, they have a place to play, whatever they need, and just relax. And their parents know that they're being supervised and in a good environment. And they also get prevention workshops and education. They get a lot of out of it. Socialization skills, support services for the parents. We also have the respite program, which provides respite for the parents who have kids with, like severe behavioral issues or ADHD, ODD, oppositional defiant disorder, or, stuff like that. So there's a lot of services that are direct services. We also have the community mental health program, which I mentioned before, that goes everywhere I send them, they go. They go to doctor's offices, they go to consulates, they go to churches, they go to lawyers' offices, where it's like a non-traditional way to educate the community about mental health. And then additional to that, we have the Empire After School program that is in tandem with the Hempstead School District. We go there every day after school and we help newly arrived students that are in the district, both in the middle school and in the high school, and they're like lost. So like they've been here 3 months, 5 months, 7 months, a year, but they don't understand the school district. So we provide support for them, homework help, regents help, and we provide help with the parents. So the parents are also like, hey, I have a master's degree and I'm educated. And when my daughter told me that she had to go to college and we had to do a million things, I was like, what? So if for me it's difficult, imagine for someone who has just arrived to the country, does not understand the educational system, and they're helped where they're at. So the school, the kids are in the school, we work with the social workers, we work with the teachers, and we provide homework help, after school support, every day after school, even on Saturdays.
That's incredible work. And I'll tell you, I don't know if have you ever collaborated with the Long Island Children's Museum at all?
In the past, we did, yes. We take the kids there. We do events and we take the kids there for trips or to get the museum. Yes, but we have worked in the past, not lately, but we have.
They have a program over there, and actually I'll be there tonight because the Spirit of Huntington Art Center has an art show tonight, and I'm on the board of Spirit of Huntington. But they have a program there that I don't know what it's called because I didn't think I'd have to bring it up right now, but it's a program where it's new families that are immigrants to this country as they go to the first year of school before they have not a club, but a camp during the summer to get these kids involved, these young children, before they go into kindergarten, to really help set the stage and also support those families. So it's interesting what you're talking about. There might be an overlap there, which brings me to my next point. We're going to take a quick break. We come back. Last time we were hanging out, we were sitting together at a gala up on the North Shore in Bayville for a federally qualified health center called Harmony Healthcare, and we got to hang out a little bit that night. I want to talk when we come back a little bit about collaboration that you have. I see you mentioned the DA's office. There's so many different resources, and I probably you get a lot of referrals from other organizations. So we could talk a little bit about collaboration in this last segment when we come back, and then also what do you need? What are you looking for? Are there certain people? Are you looking, do you need board members? Whatever the case may be, something that you might need. So we'll take a quick break and we'll come back and we'll jump into some of that. How's that?
Sounds great.
Right back.
Are you a high-achieving, growth-oriented leader? Are you interested in developing your authentic leadership while creating a healthy, inclusive workplace? Hi, I'm Dr. Mira Brancu, host of The Hard Skills on talkradio.nyc at 5 p.m. Eastern on Tuesdays, where we discuss how leaders develop the hard skills needed to make a greater impact. We interview experts, have live coaching, and tackle these challenges. Listen to The Hard Skills on Tuesday at 5 p.m. Eastern on talkradio.nyc.
Hey everybody, it's Tommy D, the nonprofit sector connector, coming at you from my attic. Each week here on talkradio.nyc, I host the program Philanthropy and Focus. Nonprofits impact us each and every day, and it's my focus to help them amplify their message and tell their story. Listen each week at 10 a.m. Eastern Standard Time until 11 a.m. Eastern Standard Time, right here on talkradio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays, 12 noon on talkradio.nyc.
You're listening to Talk Radio NYC at www.talkradio.nyc. Now broadcasting 24 hours a day.
Nonprofits need connections to move in good directions. So cut through all the static. Join Tommy in his attic.
And we're back. Go through the static. Claudia, this has been really interesting and a lot of fun to really get to understand your background in the organization. As the nonprofit sector connector, I find it always insightful to hear about different strategies and collaborations that organizations have with other, whether they be governmental bodies, as you mentioned, the DA's office, to other nonprofit organizations, things like that. So I'd love for you to share some of those. And then also, what can we do for you? Is there certain things, certain either services or resources that the organization could use right now?
Well, I mean, in terms of collaborations, I wish I could share with you, we have a program chart, and at the bottom of the program chart, we have all the collaborations that we have, whether it be small or big. But in a general sense, even with Harmony Healthcare, we work really close together with federally qualified health centers, both in Nassau and Suffolk. We work with the courts, both in Nassau and Suffolk. We have relationships with other agencies that do similar work as us. For example, one of our grants is in collaboration with FCA, which is Family and Children's Association, Family Service League, with CNG. So we work in very different arenas together in different ways. Like, for example, I'm part of the COD, the co-occurring disorder conference. So that one we put together with all of the agencies that deal with mental health or substance abuse or youth services. So there's a lot of opportunity for collaboration, because whenever we identify a need, we want to go and help. So Northwell is a wonderful supporter. Catholic Health is a wonderful supporter of ours. So we work with the different health systems, with the different FQHCs, with other organizations, with the courts, with the legal system, in many, many different ways. So we can support our clients. So when I mentioned the one-stop shop, I didn't mean it because I do everything and just come here and solve the problem. We connect them to the services that they need. So if we don't do it, we'll connect you with someone that does, because our focus is the client. Their needs need to be met, and we meet them however it's necessary. So one of the biggest connectors that we have right now is our community mental health and promotion program, because we go anywhere and everywhere. And the good thing is that we are funded with 2 other agencies. So we cover all of Long Island together. So if somebody calls me from a place that I'm not supposed to be covering because it's not in my catchment area, I just pick up the phone and call the other agency and say, hey, I have Tommy who needs help, but he's in your coverage area. So it's about working together for the good of the people, right? So we have so many collaborations and so many people that are interested in helping the community that if we see an opportunity, Hofstra University, a lot of people from Hofstra, we work very closely together to educate the community. I'm part of the Health Equity Task Force with Northwell. So there's so many different avenues, Tommy, that we can work together and that overlap one way or another, that the ultimate goal is that, right? To help the people.
Yeah. It's organizations like yours and the organizations you collaborate with that are changing the world and doing the incredible work. And it's ironic that, there's been some discussion out on Long Island, specifically in Suffolk County, as it relates to income of executive leadership of nonprofit organizations. And, there's a couple of these legislators out on Long Island that, if they only understood the work that you all were involved with, if they had any concept of what goes on in these agencies, other than just trying to make a name for themselves, as some kind of, cowboy or cowwoman, saving, they're wrong. You're wrong out there, gang. I'm not going to get into that now. We don't have time and it's not appropriate. But the point of the matter is this: nonprofits absolutely are on the front lines doing the special work, the incredible work. And I know, like many other leaders, you're going to say it's your team, so it's you though, as well, from the leadership perspective. Maybe you said earlier, you don't feel maybe as much of a helper, so to speak, in the role you're in right now, but somebody leads the organization and somebody is on the front line up from the top, telling people and telling the stories. And I'm glad you were here to do just that. So thank you. And I got to say thank you to Sam. I got to text him in a little while and just say thanks for making the connection. And I hope we continue this relationship. What I want to close with is there any specific needs right now that the organization has? You might say, hey, look, we're looking for a building, or what is it for you all right now?
I mean, there's a couple of things that I could focus on. Definitely my greatest need is always the youth programs, because even though in your head it should be logical that children should be at the forefront, a lot of times they're not. So a lot of the funding that we get for the kids is not enough for the programs that we provide. So we always are looking for other source of funding that is not attached to a specific thing so that we can use it for our kids. We use it for their after school program. We use it for them to be able to learn and socialize and to get to know the world. So that's one of the needs that we have. We are always looking for, people to volunteer and help when it comes to our holiday. We do a holiday event for our kids. We have about 300 to 400 kids that come. This year is on December 15th. We have Santa Claus. We take a picture with Santa Claus, and then each child leaves here with a bag of toys that have been donated. So there's always a need for that. There's a wish list that we created. I can share that link with you, and then maybe we can share it as part of the podcast. We do backpack events every year after school. We are restructuring now and looking at our board of directors. And yes, we are looking for committed board members that can help us grow the organization. And in terms of growing, we also we're looking for space in Suffolk, not immediately, but we are looking for space in Suffolk to grow, because the clinic that we have in Suffolk is not big enough for the demand. So looking for space.
Not big enough for the demand, gang. You heard it here first, right? There's services that can be provided and are not being provided because, I don't know, because we don't have a building that's big enough. I mean, that sounds like on its face, like, ooh, that's complicated to get a building. Is it that complicated? No, right? Somebody can help figure these things out and support it, right? You were going to say something.
No, I was just gonna say that it's not difficult per se, but it does take time, and it takes an effort. And related to what you said earlier, we have to look for funding to be able to support a bigger space to support what we need to do. So
yeah. I want to just correct myself, because I wasn't making a commentary that it's no big deal for you to get a building. I say as a society, as this island with many wealthy people, many of them in the real estate space, that's not so difficult for somebody to say, hey, utilize our space, right? That's the thing that I mean. Like, as a society, when we have organizations like this that are serving on the front lines, it takes philanthropists to come in and bring in things and opportunities. And I don't own a building, so I could talk all about this a whole lot, but I don't own a building that I can lend or donate.
But maybe someone who's listening knows someone who has a building, and we can use that space.
That's exactly right. So the other thing I saw is, it might have been on LinkedIn. I thought it was on your website. The organization is currently hiring right now.
Yes, we are. We're always hiring bilingual professionals, both in the bachelor's levels and master's levels, because our programs, they're growing. And our clinic currently has about 13 therapists, and we need at least 3 more to deal with the demand. Bilingual, bicultural, master's level, either social work, mental health. We have a licensed clinical art therapists. We have licensed marriage and family therapists. So the gamut.
A lot of opportunities.
A lot of opportunities.
We got to leave it there, because we got a show coming up right after my show. Claudia Boyle, thanks for being here. Hispanic Counseling Center out here on Long Island. Appreciate you, Claudia. Appreciate you all listening and checking in. If I could be of service to any of you, it's Tommy D at Philanthropy and Focus, PHOCUS, or hit me on Instagram, TommyD.NYC. Make it a great day. Claudia, thanks for being here. Bye.
Thank you, Tommy.
Nonprofits need connections to move in good directions. So cut through all the static. Join Tommy in his